Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Next, orbital fissures. In the orbital fissures, we have different types of the orbital fissures actually. So for the first orbital fissure is inferior orbital fissure. So in the picture, this is the inferior orbital fissure. Where is it present? It is present between the floor and the lateral wall of the orbit. So it is present between this is the floor and this is the lateral wall. Between the floor and the lateral wall of the orbit, we have inferior orbital fissure. So this is the inferior orbital fissure. This inferior orbital fissure, this is the fissure. This will contain the infraorbital nerve. Okay, so this is the inferior orbital fissure. So fine. So in between the inferior, in inferior orbital fissure, that is between the it is present between the floor and the lateral wall of the orbit. It is present between the floor and the lateral wall of the orbit. It mainly contains the infraorbital nerve. So this is the infraorbit. This is the inferior orbital fissure. It contains infraorbital nerve, which is developed from the maxillary division of the trigeminal nerve. Then it also contains one more nerve, which is zygomatic nerve. This zygomatic nerve is also from maxillary division of trigeminal nerve. Then there is an inferior ophthalmic vein. These are the emissary veins which are connecting the uh, pterygoid venous plexus. When many emissary veins are seen, and infraorbital artery will also be seen, and inferior ophthalmic vein will also be seen. This is the infraorbital artery, and along with that there are some ganglionic branches from the pterygopalatine ganglion are also seen in the inferior orbital fissure.
thank you and thank you for watching.